Hey guys, Dr. John here with Water and Sports Physical Therapy at Fitness Quest 10. Today we're going to be talking about PSD, Postural Stress Disorder, and how it can cause some cervical and some thoracic spine issues along with some shoulder problems. Postural stress disorder, as you can see here with Brittany, at the shoulder and the upper back, is a rounding of the shoulders here. So it's a tightening up of a couple different muscles. So it's your big muscle, that pectoralis major, the littler muscle underneath, which is the pec minor, and also one of your internal rotator cuffs called the subscapularis. So when those get tight, the shoulder internally rotates, protracts forward, and actually elevates a little bit too. So you carry a lot of stress through the back side of the back here, through the T-spine. Along with increased stresses at the shoulder, the upper back or the thoracic spine can also have some stresses through it. So a normal curvature at the thoracic spine is called a thoracic kyphosis. So an increased kyphosis or an increased bend can put some increased stresses over the structures around the back and the vertebrae themselves. When that increased kyphosis happens, it feeds into the shoulder protraction and also lengthens out all the stabilizing muscles of the shoulder blade or the scapula. This can cause some regional pain. It can also cause some cervical issues. So site 1 from postural stress disorder of the shoulder, site 2 being the thoracic spine. Site 3, when the thoracic spine's into a little bit too much flexions, the shoulder is forward, is the cervical spine or the neck. So the neck actually has two different types of segments. So you have the upper cervical spine and the lower cervical spine. So in a postural stress disorder, the lower cervical spine will actually flex forward. And in order to keep your head upright and in contact with your environment, your upper cervical spine actually has to extend a little bit more than we want to. So these stresses actually put increased stress over not only the muscles, but those discs between the vertebrae. Because PSD is so common, we see it in every person that comes through the door, whether it be a professional athlete or an office worker. So it's really important to do a couple of prehabilitation exercises before pain becomes a dysfunction and you end up in our offices. So 2 exercises that we're going to go through that you can do on a daily basis are a chin retraction and also a pec stretch. First exercise that we're going to go through today is a chin retraction. So that's putting the cervical spine or the neck into extension after it's been in flexion for so long through postural stresses. So what Britt's going to do here is she's going to draw her chin directly back towards my hand on the back side here, and that's going to extend the spine. She's going to come back to neutral and then repeat. So guys, it's really important not to come farther back into pronation at the neck when you're coming back to neutral. A nice cue that I like to use is my finger in an L shape here. So you're retracting straight back, holding for about a second, and then coming back. So chin retraction can help to decrease those postural stresses through the neck. Second stretch we're going to go through today is called a doorway stretch. So it's used to stretch out the pec major and also the pec minor. So what Britt's going to do here is she's going to bring her arm up into elevation on the doorway. So we're going to go a little bit above 90 to about 120 degrees at elevation. Her hand's going to be right on the door, and she's going to use her body in good posture at the spine to bring her body weight forward, putting the stresses right through this pec muscle here. We're going to hold this stretch for about 30 seconds to 60 seconds, and we can repeat about 4 times. Through the practice of these 2 exercises, we can hopefully try to neutralize the shoulder, the upper spine, and the neck positioning, and keep healthy and happy throughout our exercise.